This system can be used without a drill stop. And I've done this, as you'll see in subsequent cases, many times. So if you prefer to do this, it feels like freehand drilling, but it's guided because the position of your entry point on the gingival surface is defined, and because the center of the guide hole defines the second point of your trajectory. So it feels like freehand drilling, but in fact, it is guided. In this case is a flapless case where we placed implants in the upper right posterior segment. The patient was missing teeth number 3, 4, and 5. And on the bottom panel, you can see the ThinLayer guide. And on the right-hand side, this is done a little differently. This is a pilot hole guide. It sits right on the surface of the gingiva with holes to guide the pilot hole drill. So here's the pilot hole guide placed on the patient. We go through each hole with the 2-millimeter drill, and you can see we have our pilot holes, just very shallow little indentations. Next, we go through with our series of drills where the drill is centered in the guide hole, the tip is in the pilot hole, and we drill to depth. We're using the depth markings on the side of the drill. Here you can see the position of the 3 implants with guide pins in place. This was a flapless case, so we used a tissue punch, and we used the guide hole here to allow us some control when we place the implant. This is the finished case, and you can see the position of the implants radiographically and clinically, and the final restoration. And the restoration was very straightforward because the implants were positioned in a rather prosthetically ideal way. You're not restricted by a tube. So if you don't like what you see, you can change it. But when you change it, you have to be aware of your cross-sectional view so that the change is compatible with the anatomy of the bone. But I've changed many a trajectory when I didn't like what I saw, and they work out fine. Let's say the entry point is off, and you want to move it a millimeter or half a millimeter one way or the other. What you do is you look at your scan, and you see if you do that, how does that affect the trajectory? And you can make an alteration either only in the entry point, or sometimes you can make an alteration in the guide hole. You can put crosshairs on the guide hole. You see these crosshairs here? Let's say you make a mark a half a millimeter to this side here, and you move this a half a millimeter this way. You'll have the same trajectory, but you'll slide the implant a little half a millimeter in that direction. So yes, you can have flexibility in, you can change the plan at the time of surgery.